So let's talk today about dysmenorrhea. Now, dysmenorrhea, which is a fancy name for painful menses, is something that almost 45 to 90% of women experience all over the world. Some even consider it as a normal part of the menstrual cycle, but it doesn't have to be so. So let's discuss a little bit more about it. What are its causes? What are its treatments, its investigations, a few home remedies and supplements that can help. So let's start with the causes. So dysmenorrhea could be of two types, primary and secondary. Primary dysmenorrhea is something which has no known cause, so we attribute it to either a poor emotional state, a bad genetic history, or a bad lifestyle. Whereas secondary dysmenorrhea is something where you see more pathological changes. So it could be seen with your endometriosis, it could be seen in endometrial fibroids, it could be seen in endometrial polyps, we can also see it in adenomyosis, pelvic inflammatory disease, and if there's an intrauterine contraceptive device that is inserted, it can also lead to symptoms of dysmenorrhea. So now that we understand what could cause it, what is the underlying reason why the pain occurs? So now that happens because there is an inner lining of the uterus called as the endometrial lining. Now the endometrium is what secretes prostaglandins during the first few days of your menstrual cycle. Now these prostaglandins that get secreted by this uterine lining then stimulates the muscle layer of the uterus, which is called as the myometrium. And this myometrium starts going into intense contractions. These contractions is what causes the pain of the dysmenorrhea. There is also ischemia that gets created in the uterus because of the release of these prostaglandins. And that's another reason why we feel this intense agonizing pain. Now, what are some of the associated symptoms along with the dysmenorrhea? We normally see there's nausea, there could be vomiting. Sometimes the pain can get so intense that you even land up fainting. There can be bloated feeling, uneasiness, you don't feel like eating, intense weakness, pain all over the body. There could also be some form of mental symptoms like your mood swings, depression, anxiety, irritability. And so when you get all of these symptoms, what is the first thing that you need to do? So a basic investigation that would be required for dysmenorrhea would be one, a good detailed physical examination of the cervix of the vagina with a gynecologist, and would be a basic pelvic sonography. So both of these would be able to tell us where the problem is located and if there is a problem, and then you could deeper investigate into it. Coming to the treatment part of dysmenorrhea. Number one, address the lifestyle. See if there's something that needs some form of changing. Now, dysmenorrhea is more commonly seen in women who lead a sedentary life or are undergoing some form of depression, anxiety disorder, or mood disorder. So make sure that you deal with all of that before you start dealing with the actual complaints of dysmenorrhea. Because once all of that gets resolved, automatically your dysmenorrhea could get much better. Second is nutrition. So there are a lot of foods which are known to help with relieving the pain of dysmenorrhea. So this is a list of all the foods that are required to be taken, probably a week or two before your menses are about to start, and once they start for the next 4 or 5 days. All of this will help relieve the discomfort, the intense amount of blood that gets congested around the area of the uterus. Thirdly, start some form of holistic treatment, which not only addresses the cause, but also helps you address the symptoms and relieve some of the pain and discomfort feeling. Fourth, there are certain home remedies that can really help in relieving your pain. So I've enlisted the top 6 home remedies that I feel will help you with your pain during your dysmenorrhea. And these are the 6 home remedies. 1, 2, 3, 4, 5, and 6. Now, along with these home remedies, make sure that your balance of vitamins and minerals in the body is also adequate. So these are the top 6 supplements that can again be deficient in someone who's suffering from dysmenorrhea. So make sure by consulting your physician if you have some form of deficiency, and if you do, rectify it. So these are the list of the top 6 supplements. I hope you all found this video useful and it covered almost everything that you need to know for tackling this uncomfortable, very uneasy feeling. If there are any more questions that you have, please feel free to comment below or send me a message via direct message. Thank you.